If you didn't know before, you're learning right now that the days after a storm passes definitely can be incredibly stressful, and it's very important that you make sure you're taking care of yourself. Anthony is standing by now with a local expert who has some insight for us on what we can do to make sure we're taking care of our mental health. Anthony?
That's exactly right, Heather. It's so important right now, and I'm joined now by Dr. Michelle Slater. She's a counselor here in Jacksonville. I know you specialize in helping those with stress and trauma. And right now, a lot of people going through a lot in our community, especially those who have lost businesses, who have lost homes, or had a lot of damage, I should say, because of Hurricane Irma. I have one friend, her business and her home was damaged. So how do you help these people deal with everything they're going through right now?
Slowly, patiently. You know, I think there's no easy answers in situations like this. This type of aftermath is so huge and impacts so many. So, you know, in the immediate aftermath, people are worried about safety, security, stability, making sure they have a place to stay, and support is critical. If it's friends, neighbors, family, local churches, seeing the community support all around, and then of course mental health services for those who are struggling to cope with the aftermath.
And let's talk about our first responders, even our TV reporters who have been working around the clock. That can take a toll on you as well. What would you tell them?
Oof, absolutely. That's first responders and the people that are still actively engaged in reporting. It's get rest when you're able to, know your limits. I think access support. There's a lot of times, particularly first responders, we need to stay strong for everybody else, and you can't really be helpful if you're not taking care of yourself first. It's easier said than done, certainly. But ultimately, I think I would say some mindfulness of the signs of crisis. If you're not coping well, not able to sleep, not eating appropriately, flashbacks, there are a lot of cognitive warning signs, confusion, disorientation, and that happens, lack of sleep, and go. So really checking in with each other, coworkers that are keeping an eye on each other is important, and doing your self-check is really important. How are you coping? And a lot of times we're moving so quickly, we don't take the time to stop and check in with ourselves.
Right, so before we go, just the top 3 things that everyone should know right now.
Right now, I would say expectations. Keep your expectations realistic. It's a new normal for a lot of people. Manageable goals. You can't get it all fixed right away, and so being able to what needs to be done today and to sort of feel good about that instead of looking at all that isn't done yet or that you're not able to do. And then just support. Friends, family, you know, research tells us that getting the support, talking about it, helps. That's the quickest path to recovering.
Yep, that support is so important. Thanks again, Dr. Slater, for joining us.
You're welcome.
Heather, back to you.